Hello, everyone. This week we're going to talk about the intersection of medical care, direct care, and public health, and some of the implications, some of the policy behind it, and then what the potential effects are. So I want to start by getting you to think about what is healthcare, or at least who should get healthcare. Is it a right that everyone in the country should have access to at least basic healthcare services, or is it a privilege to get healthcare because you can afford it? Right now, there's actually a majority of the country thinks that healthcare is a right, saying that the government has a basic responsibility to ensure healthcare coverage of the population. This is in line with historical information, but is a large deviance from the past few years, basically since the Affordable Care Act is passed. Before Obama administration took office and the ACA was passed, about 2/3 of the country thought the government should be providing health care. He's in office, the numbers basically evened out until healthcare was essentially being attacked by the Trump administration, which is a very interesting trend line. And it is worth pointing out that we are one of the very few developed countries who do not view, at least officially, healthcare as a right. All of these countries in green are the countries of the world who have a universal healthcare system and have it and view their universal healthcare system as a constitutional right. So Brazil, for instance, actually has it written into their constitution that there should be or there needs to be a universal healthcare system. So there's this conflict between medicine and public health. The majority of people on public health believe strongly, or at least strongly think, that there should be a universal healthcare system, that everyone has a right to public health. This isn't always the case on the medicine side. And part of it that is the idea of who's actually responsible for ensuring someone's health. Medicine, on the medicine side, or the more medical argument, basically they take the point of view that the responsibility for a person's health is on the individual, and the responsibility for providing that health is another individual, a physician, a nurse, a physician's assistant, some non-government source. Essentially, it's a private transaction between two people, and you can do whatever you want. Those people can do whatever they want. Public health, on the other hand, is saying that no, this is really a government problem, it's a population level problem, and everyone needs to be involved in coming up with solutions for that problem.